Honorable Member of Parliamentary Committee, colleagues, thank you for being here today for this crucial briefing. I'm Jiayi, advisor to Home Affairs Minister. Today, we will explore the profound impact of COVID-19 on society, focusing on three specific groups: low-income families, marginalized community, and elderly people. We will also discuss potential policy responses and identify which issues should be prioritized. First, let's focus on problems caused by COVID-19 for three groups, and then let's examine the impact of COVID-19 on low-income families, marginalized community, and elderly people. Low-income families. This family face significant economic hardship. The pandemic has led to job losses and reduced income, making it difficult for them to meet basic needs such as food and housing. And let's go to this chart from CATS V 2021. And when we see this chart and discuss it, we will find that low-income families who with children will face a situation their child may had to miss class and they cannot finish their work and participate by cell phone at some point in the past 12 months. Like you say, most of them are over 15, and some people are 42%. And due to lack of sufficient computer or internet access, these kids they have to delay their education. And then let's go to marginalized communities. For them, health and social inequality has been exacerbated during the pandemic. This community experiments higher infection and mortality rates with inadequate access for the health care resources. And also, let's focus on this chart. We can say 32 factors were identified as influences on COVID-19 wage or under vaccination across 103 included publication. Among these, 9 of them are structural, 7 are social and community, 11 individual, and 5 are specific factors were identified. But overall, structural factor are number one in this chat with number 175, but followed by social and community with 162. So we can note that community issue occupies the second place in the table, which means this marginalized community they are facing inequality and it's a major problem because it's in rank two. So that's the reason why it becomes second group and we will discuss it. Then third group is elderly people. The elderly people are one of the most vulnerable group in the world, and as the age grows, their health indicator began deteriorate. And with the advent of the COVID-19, government are trying to do everything they can do to inform the elder people of the things they need to do and pay attention to it to make sure they are in safe. For example, they tell the old people you should keep away, keep some distance from your neighbor or your friends, and also focus on the air circulation. And also, when we discuss this chart is very unfortunate that the global COVID-19 is very relative to our age. The infection fatality rate by age has increasing from 15-year-old later, and especially for some elder people at 17 or elder. And then the next part is example of the issue and analysis. For this part, let's devolve deeper into this issue with some specific examples. First of all, is also the people with low income families. Economic part, the pandemic caused a significant spike in unemployment. Unemployment rates, especially among these families. Many of these families were employed in sectors like retail, hospital, and service industry, which were hit hardest by lockdown and restriction. unemployment rates in low-income neighborhood increased by 15% compared to pre-pandemic level. And the other reason, another example we should focus on is food insecurity. With the loss of income, many families struggle to afford basic necessary food, leading to a struggle in reliance on the food bank and assistance program. For example, the reports from Sharma, and we can also see this from chart, indicates that demand of the food assistance increased by seven from 17 in low income area during the peak of the pandemic increased to over 90% now. And the next part is also marginalized community, and we will discuss something about their healthy disparities like infection and mortality rates for these communities, including some racial and ethnic peoples, is they are experience higher infection and mortality rates due to the several factors, including some crowded living condition and essential work roles. For example, data from NIH shows that infection rates in marginalized community were twice high as no marginalized community, and the mortality rates was similar if validated. And then the access to the healthcare is also a problem. Those community often has limited access to healthcare facility, resulting in delayed treatment and worse health outcome. So we can find that marginalized community has fewer healthcare facility per capita compared to richer area. And then is social inequalities, housing and living condition. Crowded housing and poor living condition contribute to rapid spread of the virus. For example, in some rural city, marginalized community reported living in overcrowded home at rates 3 times higher than the city average. And we can also focus on this group, this chart. The rich people they are able to get vaccination rather than poor people. So it's also maybe a reason why they have to face some treatment problem. And then is elderly people, vulnerability to the COVID-19. Elderly individuals, especially those nursing homes, were at higher risk of several illness and deaths due to the COVID-19. The virus spread rapidly in this facility. It can be inferred from this chart that equivalent to young people, the elderly will more operate with the government with their isolation policies, and but it will come with some mental healthy. Social isolation measure will necessary to protect the physical health lead to increasing rates of depression and anxiety among the elderly people. For example, a survey from China shows that 16% of elder individuals reported feeling of several illness during the pandemic, up from the 20% only pre-pandemic. And this part, we will discuss the police response to the issue, and and then let's talk about what governments will do. First of all, is strengthen social safety nets. The part is target area or people. We are focused on low-income families and marginalized community, and providing economic support and ensure access to healthcare resources is very important for us. It can make death rates lower and tell people they will be healthier rather than before. Then the action we will do is increase unemployment benefits, food assistance, and expand healthcare access in marginalized area. Then we are going to improving elder cares, and obviously our target is elder people. how providing information on this paper. So we can like provide some newspaper or ask some people or volunteer to tell the other people to make sure the virus in the virus spread facility can be lower than before for the elder people. And the action we will do is increase funding for nursing home and provide some mental health service to us elder people. And also, we're going to enhance public health education. Our target is all of people. It's very important for people to raising their awareness and reduce infection rates. For people, we are going to promote vaccination and disseminate accurate health information to reduce some people's the chance they will get a COVID-19 or some pandemic. So I think that's very important for us to make all of people be safe. And then I will say the priority for us is low income families. And I will also explain this from different part. First of all is economic hardship impact. So for them, low income families face challenge in the meeting their basic needs such as food, housing, health care, like we say, addressing this need to prevent immediate crises like hunger and homeless. So it also will increase in economic stability, providing some financial support to low-income families can help stabilize the economic and increase consumer spending by their families, and also help the local business and create positive economic cycle. Then is health and well-being part. Health and care access for low-income families often have limited access to health care, leading to higher rates of untreated illness and COVID-19. Providing this targeted people health care support reduce overall health care cost and improving community health and also mental health. Financial stress and insecurity can lead to mental health issues such as anxiety and depression. Address this economic pressure can also improve the mental health outcome, social and educational impact. Then, last part is education. The reason why is education is very important for all of people, all of the countries future, children from low-income families are at a risk of falling behind in their education due to lack of resource for learning or other education supports. Providing supports ensure educational continually and future opportunity, and it also increases social stability. Economic instability can lead to increased crime and social unrest. By addressing this problem for the low-income families, we can enhance the social cohesion and decrease the crime rates. And when we focus on this chart, we will see that rich people are much safer rather than poor people from different wave. And I think that's also a part of the reason why we gonna make the low income family on the priority one. And thank you guys, and this is a reference list.